Good afternoon, everyone. Thank you for joining us today. This webinar today is more of our resources sessions that we are hoping to hold throughout this next calendar year. I'm really excited to introduce one of my colleagues and actually coworkers within the OSU Center for Rural Health. Nicole Nielsen is with the Oklahoma AHEC program. And I like to say, if you knew AHEC before, the programming is really different than what it was many years ago, and so I thought this would be a great opportunity as a refresher and just a new introduction for folks. And so, Nicole, I'll turn it over to you. We are a smaller crowd, so if you have any questions, please feel free to unmute your line or put something in the chat. I'll be watching the chat if you're watching this recording, and if you have any questions, please feel free to reach out. That said, Nicole, I'll turn it over to you.
Thank you so much. Thank you for having me today. I appreciate the opportunity to get to share a little bit about what the Oklahoma AHEC program is up to. And it's been a fun adventure the past few years. And so we're going to jump right in here and start with a little bit of history here. If you are not familiar with the AHEC program, AHEC stands for Area Health Education Center. The program was initially developed by Congress in 1971 to help fill a dwindling healthcare workforce. So it's to recruit, train, and retain health professional workforce committed to working with underserved populations. The AHEC is a 5-year cooperative agreement funded by the Bureau of Health Workforce of the HRSA, the Health and Resources Services Administration. Across the country, AHEC is a network of more than 300 program offices that covers 85% of United States counties. And so most states have an AHEC program within it. All right, so what do we do? The purpose of the AHEC program is to meet the needs of the communities they serve through our community and academic partnerships, with the main focus being exposing and providing education and training to current and future healthcare workforce. If you're familiar with AHEC at all, you may know the saying, get them, train them, keep them. And that's kind of been when I started working with AHEC in 2018. That was what I learned, was one of the old sayings, and it still holds very true today. The strength of the AHEC network is in its ability to adapt to national initiatives and things that are going on that are important within healthcare. We focus on primary care for rural and underserved communities. So everything we do is trying to get healthcare out into the rural and underserved areas of Oklahoma. So the Oklahoma AHEC program consists of 4 regional centers and a program office. So we have a center in Northwest Oklahoma in Enid at the Rural Health Projects Office. We have one in Southwest Oklahoma in Lawton, located at Comanche County Memorial Hospital. We have a center in Tahlequah at Northeastern Healthcare System. And then recently, this past year, we have added a new center at McAllister Regional in Southeastern Oklahoma. So we're spread across the state. The program office where I'm located, I'm in OSU, at the OSU OKC campus in Oklahoma City. And then I think on the call today is our Assistant Director, Lauren Sparks, and she is in the center, she is located on the Center for Health Sciences campus in Tulsa at the Center for Rural Health. Okay, so like before, Laura alluded to there being AHEC looking very different. And primarily in the past, AHEC was the recruitment of retention. So it was a lot of pipeline. And I started, so the Oklahoma program was actually, AHEC program was actually shuttered between 2012 and 2017. And when they did the rewrite for the 2017 5-year cycle, HRSA had decided to change the way that the AHEC program was structured by introducing this AHEC Scholars Program. And they changed it up with the way the funding worked, was that no more than 10% of the funding that was given to each AHEC program could go towards pipeline and continuing education. So it really put all of the eggs in the scholars program. And so it was easy as far as me entering the world of AHEC, because I didn't know anything from the past. And so when the scholars program was introduced, it was new and exciting, and I was ready to go. There was a little pushback nationally from it, because it was just so drastically different to compared to what had been done in the past. So we're going to take a few minutes and talk about what, as far as the pipeline program goes, we're focused on students between in the grades 9 through 12, getting them interested in going into the healthcare field. And so the Oklahoma AHEC program does that by working with a handful of the programs that are offered through the Center for Health Sciences, such as Operation Orange, Dr. Pete's Immersion Camp, Pre-Health Roundup, and the Youth Medical Mentorship. So the AHEC centers each try to get the word out that when these events are going on campus, try to get students interested in going, and then we volunteer hands-on at these events. So that's kind of what we do at the university level, because we are sponsored. I probably should have mentioned that at the beginning, and I apologize. We are sponsored. The AHEC grant is sponsored through Oklahoma State University, through the Rural Health Office, the Center for Rural Health. So at the university level, Operation Orange, Dr. Pete's Immersion Camp, Pre-Health Roundup, and the Youth Medical Mentorship, we're involved in all of those programs that are going on. Now, at the center level, each center has different events that they do within their region as well. And so one of the ones that I kind of picked out to talk about today was the Club Scrubs. They are, and I don't know if this is a program that goes throughout the state. I know it's pretty active in the high schools that our Southwestern Center in Lawton works with. So they support Club Scrub, and they travel to the different high schools that have Club Scrub programs, and they're able to do CPR and Heimlich training. They've done classes on the use of splints and wound care, burn care. A lot of our centers have had the ability to get simulation equipment that they can take. And so to these schools, to give these students a chance to see kind of, get a little bit more hands-on experience with different professions in the healthcare field. So we also work on continuing education. So we've talked about pipeline a little bit. And so our next area that we focus on is continuing education. Again, we share throughout our centers and with our rural providers the Project ECHO. If you're not familiar with Project ECHO, it's the ECHO sessions are virtual, and they're designed around case-based learning to help local people out in the field in rural parts of Oklahoma and across Oklahoma gain experience required to provide needed services. So, and they have different Project ECHO has different service lines that they do. And so if you're not familiar with that, let me know at the end of the presentation, and we can get you some information on that. It's a really awesome opportunity for providers who can't make the trip to the university or to different areas for training, take time away from their clinics and their patients and everything to go get training. These Project ECHO sessions also offer continuing education credits. So it's really a pretty great opportunity for providers in rural areas to kind of keep up and with different things that are going on. We also, through the AHEC program at the center level, again, so we participate again in what the university is doing, and then we have things that are going on at the center and region level. So some of our center sponsored trainings have included advanced cardiac life support, basic life support, casting and splinting labs, emergency simulation labs, this whole list. I won't bore you and read it, but on top of these different trainings that we do, we also have people within our AHEC centers that are certified to do mental health first aid training. We are also doing this coming year, we're working on getting more people. We already have one of our center directors, our center staff, trained in doing crucial conversations, and we're adding QPR training, question and persuade refer training as well this year as some others. And so these are opportunities for the community, different communities that are in need of these trainings, to reach out to the AHEC Center, and we can work with you to, if we can't provide the training, we can find somebody to help provide the training. So like I mentioned before, the majority of our time goes to our AHEC Scholars Program. And the Scholars Program was developed by HRSA. The idea of the Scholars Program was to keep the training consistent, try to keep something as far for evaluation purposes. I'm sure, again, if you're familiar with AHEC at all, you've heard the phrase, if you've seen one AHEC, you've seen one AHEC. And so the Scholars Program was an attempt to keep one program with the same goals and the same evaluation throughout all of the centers across the country. So they could better show the change and all of the great things that AHEC is doing. And so the Scholars Program, the goals of the Scholars Program are to aim and improve the diversity and distribution of the health professions and to support systems transformation across the state. And so what we do is, it's a 2-year educational program. We offer a stipend for the students who participate. There are 80 hours. Each student has to complete 80 hours of didactic content and then 80 hours of clinical experiences. And so that's chopped up, 40 hours of each year of the 2-year, and when they participate for 2 years. Applicants have to be enrolled in a health professions degree program. They have to be 2 years from program or degree completion, because we'd like them to complete the Scholars Program at the same time that they're completing their academic program. And they have to commit to 2 years in the program and a one-time program follow-up. These are the 8 core topic areas that HRSA identified that we plan all of our programming around. And so we have the behavioral health integration, connecting communities and supporting health professionals, cultural competency, current and emerging health issues, interprofessional education, practice transformation, social determinants of health, and virtual learning and telehealth. The connecting communities and supporting health professionals, virtual learning and telehealth were added this past grant cycle, this 5-year cycle that started last fall. And so previous to that, it was 6 core topic areas. So I think with the COVID pandemic, it added, it was recognized that there was a need for supporting health professionals with provider burnout, and virtual learning and telehealth was also added. And so because everybody had to pivot at that time. And so we'll talk about that here in just a second on how that really kind of affected the Oklahoma program. So the program requirements for our Scholars Program is each scholar has to attend a virtual orientation at the start of each year. And this kind of, includes the introduction, program staff, core topic areas. So for our students that are participating in the first year, they kind of get the layout of the program. And then for the students that are returning for the second year that are attending orientation, they get the opportunity to meet the current cohort of scholars that are coming in. Previous to this year, we ran the Oklahoma program a little differently. It was all online, and we had to do that because of COVID. So the first grant cycle that I started working with started in 2017. That first year, because it was the inception of the Scholars Program, HRSA gave everyone one planning year. And I did not come on into this position until June of 2018. So we were already kind of halfway through our planning year. So when I started within this position, we had to hit the ground running. And I'm thankful to have the center directors and the staff that I've had, because I couldn't have done it without them. But so we launched our program in the fall of 2019 with all of these great ideas and all of these wonderful hopes and dreams. And then everyone knows what happened next spring. The pandemic hit and everything came to a screeching halt. And so we shifted and moved everything online. And after doing that for the remaining of that grant cycle, we kind of realized that while that was great to provide students the flexibility and the access, we were losing what we felt the interprofessional opportunities for these students to really work together, especially when we were talking about across the state with our centers located the way that they were. And so this past summer, we actually changed our curriculum plan to move towards simplifying it in a way that the scholars had more selection in how they were going to meet the requirements on their time still. But then we're still offering, this time around, we're offering more in person and live virtual instead of recorded sessions. And so again, the scholars have the opportunity to meet with each other, and we've added discussion sessions and really tried to just kind of keep the flexibility of the virtual, but also add in more opportunities for the scholars to work together. So with our new program, so scholars are required to attend an orientation. They're required to attend 4 out of 8 offered virtual Connect sessions. And so the AHEC Connect sessions focus on current relevant health topics, and they're virtual, so they go 45 minutes to an hour, and then there's a 30-minute discussion session afterwards. And so we have different guest speakers and different topics, ranging from talking about a different disease state to that they may encounter, or mental health, and we talk about different resources that are available within the state and the community. So those are great opportunities for the scholars to kind of find out what's going on locally and across the state. And then our next opportunity, or our next requirement, is the community health immersion. So each scholar attends one community health immersion. And that's an opportunity for them to get out into the community with their fellow scholars and learn something different about what's going on, in the community with the Oklahoma populations. And so it could be a tribal event. It could be we have a partnership with the Dragonfly Home, and so with human trafficking, and so we have different opportunities throughout the year that the scholars will get to get out in the community and learn what's going on locally as far as resources go. Skills advancements. Each scholar completes 4 skills advancement each year, and that will be things like mental health first aid, stop the bleed training, advanced CPR. So those are our just a handful of our different skills advancements that we offer. And then as far as the clinical hours, so the 40 hours of clinical hours that the scholars have to do each year, we allow them to concurrently count those hours with what they're doing in their academic program, as long as those hours are completed in a rural or underserved area. And so the center directors work with those students to make sure that the different things that they're submitting for their field placements meet those criteria. And then each scholar will complete a program evaluation at the end of the program. So some of the benefits for the Scholars Program, it's a nationally recognized program, so we provide the certificate of completion, and so I think that goes to just show that these students took it upon themselves to spend the extra time to get this training. It demonstrates their commitment to serving Oklahoma's rural and underserved populations. Get exposure to different experiences that they may not have throughout their academic programs, and also have the opportunity to network. And that's huge, because again, it gives them the opportunity to network with individuals from across the state. We do offer a $2,000 scholar stipend that is distributed by the centers based on academic achievement, or the achievement of the different requirements. And so that's a pretty great thing as well for students, because everything's expensive. We offer resume workshops and interview preparation. And we also offer throughout the year different training on soft skills. that have been identified as needed for students these days. So, and we're always adding to and always interested in adding more. So we're definitely up for any suggestions as well. So just kind of a quick rundown of how our scholars cohorts went. So we started in 2019, we had 49 scholars. COVID hit, our second cohort from 2020 to 2022 had 23 scholars. Our 2021 to 2023 cohort had 51 scholars, and then 2022 to 2024, 40 scholars. This year has been amazing because we have right now 76 scholars alone in our 2023 to 2025 cohort. And overall, we have over 100 scholars enrolled in the program right now. Our application period starts for our next cohort will start up in next May. And so we're excited for that because, when we decided to kind of pivot to this new curriculum, it was really quick. We kind of put the ideas together, utilizing Wisconsin AHEC, a very similar format to what they do, and worked with them in June, and then we turned around and implemented everything in October. So it was a pretty quick turnaround. So we're hoping that all of our ducks will be at least, maybe not in a row, but at least in the same pond by the time that we get the next cohort ready to go. There's just a map that kind of shows right now where our scholars participants' hometowns are. And so you can kind of see the areas that we're missing out on. Our McAllister Center didn't get up and fully running until this past summer. And so this map isn't entirely reflective of what the participation rate is in Southeastern Oklahoma at this time, because they have quite a few scholars enrolled. Here's just a quick scholar spotlight, of 4 of our scholars that have gone through the scholars program. We tried to highlight our scholars through our social media accounts. So just to kind of, we're really proud of them, and we're, excited for the things that they're going to do. And so we do these quite often. So if you like and join our social media accounts, we'd sure appreciate it. So our program office consists of myself, our assistant director, Lauren Sparks, Mary Beth Sawyer is our scholar project manager, and Indu Bhattacharya is our data specialist. She works on our evaluations. And some of these folks you may know. Our Northeastern AHEC Center in Tahlequah is run by Michelle Horn and Lacey Newman. Our Northwest AHEC Center in Enid is through Rural Health Projects, and it's run by Becky Zook, Sarah Pryor, and Allison Seegers. Our Southeastern AHEC Center, our new center, is run by Rebecca Lanham and Krista Williams. And our Southwest Center in Lawton is run by Monica Campbell, Michelle Getchie, and Sharon Smith. If you scan this QR code, it will take you to all of our social media accounts where you can be in the know with what we've got going on our training calendars and the different events that we host throughout the year, and find out what the scholars are up to as well. I ran through that really quick, and I apologize for being so quick, but I'm more than happy to answer any questions that you have.
While people are thinking, Nicole, we will get a copy of the slides, right, for me to send out? Okay.
Yes, I'll send that to you here in just a moment.
Perfect. Because it looks like there's a lot of links and email addresses in there.
Yes.
A couple questions I had as you were going through the slides. How can our folks get plugged in? Going back to like the pipeline events, how can they get plugged in? Would they need to reach out to their area AHEC office to say like, hey, keep me on your list or keep me in the know of
Absolutely. Yeah,
okay.
just and when I send out the presentation, it will have everyone's email links, and then on our social media accounts, it has links to if they have a web page, and then our state AHEC web page. And feel free to email any of us and tell us what you need. We're always looking for new partnerships. We're always looking for ways that we can get out into the community and teach people about what AHEC is doing and kind of broaden our reach throughout the state. And so we are more than willing to help with anything.
Perfect. And for folks on the call or watching the recording, if you'd like, you can reach out to me and I can place you in touch as well. So real quick, did we have any questions from folks on the line?
And I did forget to mention, which we have a community health worker training program that will launch in January. And it is a 15-week program that is online that is for community health workers. And so we'll be having more information coming out on that through the webpage and our social media accounts within the next couple weeks, because our application will be launching in December.
Okay, thank you. And I can also send that out to folks too.
Perfect.
All right. Well, if anyone has a question or comment or anything after you get off this call, or if you're watching the recording, please feel free to reach out to me. And thank you, Nicole, for your time today.
Thank you so much. I appreciate the opportunity.
All right, everyone have a great day.